So Fairbanks it's a small city. It's about 30,000 people. It has a few other towns located nearby. There's the town of North Pole, Alaska, down the road. It it's a small city that has everything that one would need. It has your Costco and your Fred Meyer's and your Safeway, and then we also have a branch of the University of Alaska at Fairbanks, which brings a number of academics and intellectuals and the university vibe and graduate students into the city as well. And then we also serve a number of the armed services populations that are on several bases around Fairbanks that we see as they come through the hospital and through clinic. And then, so one of the unique aspects of pediatrics in Fairbanks is that it is a full spectrum pediatric practice, which means that the team of pediatricians here cover both the outpatient clinic as well as all of the inpatient locations, including emergency room consults, the neonatal ICU, the newborn service, and the inpatient pediatric service. And so when we're on call in the hospital, we're essentially covering the whole hospital. And so you come in at the beginning of the day and you'll have a list of patients, and it's going to be a combination of kids in the NICU that are more sick and requiring respiratory support and careful management, a lot of healthy newborns that need to get discharged quickly and go home, interesting cases that are coming from the emergency room up to the pediatric floor. And the physicians here balance that with their large clinic patient list as well. And this is one of the only places in the country where we can experience that full spectrum pediatrics. And the advantage of that is that you get to follow patients from the inpatient side back to clinic and see them throughout the progression of their illness as they're healing. You also get to be the specialist because we don't have pediatric specialists here. And so a lot of our time is spent discussing cases with specialists in Anchorage and specialists in Seattle. But at the end of the day, we have to make the final call because we're the ones that are face-to-face with our patients. And because we're a little more remote in Fairbanks and because we don't have access to some of those subspecialty services here, it gives us more independence, and we need to practice a little more ingenuity in how we approach a lot of the challenges that kids have, because we see all the full spectrum of pediatric diseases here, from GI issues to rheumatologic issues to mental health challenges. But without a cadre of subspecialists behind us in Fairbanks, it's up to us to try to figure out some of their solutions to help these kids. So Dr. Nace is our site director and our primary mentor and the person who we work with most closely when we're here. She is one of those people who is somehow able to simultaneously do everything and know everything. Her knowledge of pediatrics is vast and deep. She's been doing this job for an incredible amount of time and knows the medicine that we see, the issues that we deal with, and also she knows the community incredibly well, and she is integrated into every aspect of the community, and that allows us to very easily become integrated alongside her. And so if there are any resources that we're interested in exploring in the community or any projects outside of the clinic that we can get involved with, she knows everyone and she can connect us and point us in the right direction. I know that when I arrived on my first day in Fairbanks, I got a text message at about 10 p.m. saying, hey, come on over to the hospital, we have to put in some umbilical lines. And so within about 5 hours of landing in Fairbanks, I was in my scrubs in the NICU, dealing with twins that had just been born and putting in some umbilical lines. And so she never misses an opportunity to involve us and give us opportunities for procedures, for patients, for interesting findings, for adventures outside of work. We could not ask for a better mentor, a better leader, a better doctor to work with here. When we're in Seattle, we also can serve as a liaison for a lot of the families that come from Alaska that are referred down to Seattle for medical care. And oftentimes these are families that we know because we've seen them in clinic, we've seen them in the hospital in Alaska, and so we can provide that really nice continuity for them when they're out of their element down in Seattle.